My name is Taylor Bryan Turner, Assistant Regional Administrator for SAMHSA Region 1. I am so excited to welcome you to a Diversity Inclusion Project Showcase in partnership with the National Alliance on Mental Illness, also known as NAMI, with our Connecticut and New Hampshire centers in celebration of National Minority Mental Health Awareness Month. This event aims to elevate communities of color working to improve mental health services in community and raising awareness of funding disparities and increasing partnerships. I'd like to take this time to provide a little background about the showcase and why it's so important to me that you're all here. The Diversity Inclusion Project Showcase is an opportunity to recognize CBOs, community-based organizations, for their life-saving agendas and their resiliency. We know that funding streams can be challenging to maneuver, yet your work continues and your client needs continues to grow. The pandemic illuminated where health gaps and challenges were strained, and this program helps grantees pinpoint where they might share their attention to grow those partnerships. As you can guess, many inequities were found in communities of color. For example, according to our most recent NISDA data, 90% of 2.4 million people with substance use disorder did not get any treatment. If any mental illness was noted, 67% did not get treatment. And if one suffers from both, almost 92% did not get treatment at all. In addition, we surpassed the 1 million mark of lives lost to COVID-19. And note that Black and Brown people die at 1.4 times the rate of our white neighbors. We are in awe of the work being done on the ground and being the workaround to these challenges. And it was important to me to amplify the presence of community-based organizations who are embedded in the fabric of our communities doing this work, highlighting their body of work, their population served, and the strong impacts are being made where you sit. Specifically, where Black, Indigenous, and people of color are often marginalized and where resources are often limited. We stand by the NISDA data to prove this. So DIPS is a way to honor these CBOs, elevate them, provide a platform where they can be heard, seen, and supported in a fun and fast round-robin style of innovation. It also aims to connect a more diverse pool of applicants to grant funding opportunities that stem from federal and state leaders, philanthropic organizations, foundations, and of course, our colleges and universities. It is an intentional effort. Our hope that these CBOs will gain access to block grant dollars, connect with like-minded individuals, connect with training and technical assistance, resources, and become a go-to partner in your respective states. Remember that DIPS can be tailored to many different populations, youth, faith leaders, recovery organizations, maternal health, LGBTQIA+, and HBCUs and colleges and universities alike. As an example, SAMHSA's Partnership for Equity Committee partnered with the Office of Behavioral Health Equity. Shout out to Chen, who joins us today, and the African American Behavioral Health Center of Excellence at Clark Atlanta University to showcase internship and scholarship opportunities for students of color who are interested in master and doctoral programs, right? Our federal partners also joined us to talk about their educational programs, to help with recruitment strategies, to address this workforce shortage that we face. So we try to remain a networking machine. If you are advancing mental health in BIPOC communities, we love to help you and show it off. And we are thrilled that NAMI has joined this effort to host and expand with intention partnerships to have a further healing reach in diverse populations. And so we'd like to see everyone here to begin to build relationships all year round so that when funding is available, those seeds have already been planted. So today you'll learn also about SAMHSA training resources from Perry Chan and the MHTTC so that you always feel supported and armed with evidence-based practices, as well as self-care tips and tools to maintain your health and your resiliency while you do this work. And as you know, HHS and SAMHSA just launched 988. Our nation's suicide prevention and crisis line has now only 3 digits. This number is to get you care and healing, not harm or misunderstanding. Local support and unmarked mobile crisis units are essential to combating stigma, mistrust, and optimizing hope at the same time. So we appreciate your help spreading the word on that. Lastly, our presenters and our speakers that you will hear from today will live at samhsa.gov/dips. That's our new website. You can go there for today's highlights. Your presence today means that you are willing to make a difference in community and feel empowered to outreach differently. Thank you greatly to all of our speakers, presenters, and organizers, MHTTC, ATTC, C4, and each of you. It is now my pleasure to introduce today's co-host, Liz Taylor, Executive Director of Nami Connecticut, who will talk on behalf of Susan Stearns at the mental health, at Nami New Hampshire, along with Kim Murdoch. Thank you so much for joining us today.
Thank you. Thank you. Good afternoon. And I really appreciate you giving me the opportunity to share with you Nami Connecticut's journey to becoming a diverse, equitable, and inclusive organization. We're just beginning. And so a little bit about us. NAMI, the National Alliance on Mental Illness, is the largest grassroots mental health organization working to improve the lives of people affected by mental illness. NAMI Connecticut and our 9 local affiliate chapters are part of over 650 NAMI state organizations and NAMI affiliates throughout the country. Our volunteers bring peer-led programs to a wide variety of community settings, from churches to schools to local NAMI chapters. With a unique understanding of people with lived experience, these programs and support groups provide outstanding free education, skills training, and support. It's important to note that our collective alliance mission is to provide support, education, and advocacy for all people affected by mental health conditions. And since the development of NAMI Connecticut's new strategic plan, our state organization is moving from planning to action. Prior to creating our strategic plan, we sent a survey to thousands of people in Connecticut, asking them to identify the most important goal we must achieve over the next 3 years. The bottom line from the survey: the majority of survey respondents said we needed to bring our resources to urban and underserved areas of our state. We were doing well in suburban areas, but we needed to focus on diversity, equity, and inclusion in all areas of our organization. The 2022 census told us that Bridgeport, the largest city in Connecticut, has a diverse population of over 149,500 people, with over 38% representing the Black community and 34% Spanish-speaking residents. Other urban areas in Connecticut reflect similar information. The need for our resources has come from the grassroots. But where to begin? Again, this was a very new project for us. One of our 5 strategic plan goals that was finally developed is to reach and serve a greater number of communities in Connecticut by increasing DEI in programming, education, volunteers, outreach, and importantly, in leadership development. So the first step is to create a DEI task force to work with NAMI Connecticut staff, NAMI affiliate leadership, and community partners and other stakeholders to promote actions to receive, track, and evaluate our strategic plan objectives. The task force will reflect the people we wish to serve and need to serve, and identify the educational and supportive programs to address the intersection of mental health with race, religion, ethnicity, sexual orientation, gender identity, income inequality, immigration status, and/or English as a second language. We will also create awareness of NAMI's many programs and resources through building community partners and developing new and diverse NAMI Connecticut leadership. Some of our programs are perfect for this. We can offer programs such as Sharing Hope, a video series that explores the Journal of Mental Wellness in Black communities through dialogue, storytelling, and guided discussions. We have a similar program available in Spanish, Compartiendo Esperanza, that promotes conversations on mental health in the Spanish-speaking community. Something that a lot of people don't know about is NAMI FaithNet. NAMI FaithNet is an information exchange network of NAMI members, friends, clergy, and congregations of all faith traditions who wish to create more welcoming and supportive faith communities for people and families touched by mental illness. NAMI FaithNet also encourages the role of faith in recovery for those whom faith is a key component of their experience. So although we've just started, we've had some successes in the planning and initial phases of our work. Our NAMI Connecticut Board of Directors has increased its diversity over the past 6 months. Nami Elm City in New Haven has also built a diverse board and is implementing Sharing Hope in the near future. We'll be working with them to begin the conversation about mental health in the Black community. We're developing a diversity, equity, and inclusion track for our state education conference in October. We also were very fortunate in receiving 2 grants to support forming support groups in Bridgeport, Hartford, and New Haven, along with Sharing Hope, which I talked about, and programs in Spanish. Funding is critical for training our volunteers and bringing our community leaders together. A big success to me has been being here today. Planning and working on the Showcase project with Nami New Hampshire and other partners has opened doors for us, and we are excited to continue our work in building community partners and supporting one another in our work to serve the people of Connecticut. So thank you, and I appreciate, again, having the time to be with you.
Thank you,
Thanks,
Liz,
Liz.
and thank you, Taylor. Good morning and good afternoon. My name is Perry Chen. I'm with the SAMHSA. Go ahead.
Stearns has remarks as well from Nami New Hampshire. If we can go back.
Okay,
Just
I'm too excited. Okay, please.
It's a great day. Thank you.
I suspect, Mr. Chen, that you are more exciting a speaker than I, so I will endeavor to be brief. Hi, everyone. I'm Susan Stearns. I'm the Executive Director of Nami New Hampshire, and my pronouns are she, her. Nami New Hampshire provides support, education, and advocacy for folks throughout the Granite State who are impacted by mental illness and suicide across the lifespan. Last year, we served more than 40,000 individuals. Historically, New Hampshire's population has not been diverse. And indeed, we still have a sense within the state and outside it that we are largely a white state and not very diverse. But we are seeing, and we have for some time in our larger cities and metropolitan areas in the southern part of the state, far more diversity. And indeed, amongst our youth, we are seeing much greater diversity in young folks in our state. The population here in New Hampshire includes more than 7,500 refugees who have made their home here since the early 1990s, and many of those live in those larger cities in our state. Several years ago, Nami New Hampshire's Connect Suicide Prevention Program, a nationally recognized best practice, partnered with organizations supporting Bhutanese refugees in our state, as that community was experiencing high rates of suicide deaths and attempts. We also see, in the work that we do as part of the state's system of care for children with behavioral health needs, we provide family peer support. And there we see that population becoming more and more diverse and in line with what we're seeing with the youth population here in New Hampshire. However, similar to what Liz talked about, Nami New Hampshire, in its, particularly in our larger cities where we have had our signature support groups, for example, for many years, our support group facilitators have started to say, why is it that in my group, everyone looks like me, white, and native English speaker, yet my community is far more diverse. That mindset has led Nami New Hampshire to also include in its strategic plan as one of the foundational goals, incorporating diversity, equity, inclusion principles throughout our organization, from governance to policies to programming. As part of that work, that very important work around diversity and belonging especially, we are looking to build more partnerships with organizations across our state who are serving refugee communities. Today, we are truly honored to have here to spotlight 2 such organizations, Overcomers Refugee Services and Building Community in New Hampshire. Both of these organizations are doing profoundly important work to assist refugees and new Americans in building strong foundations for themselves and their families. We all know that secure housing, personal safety, and community belonging have direct impact upon mental health. Nami New Hampshire is looking forward to working with Overcomers Refugee Services, Building Community in New Hampshire, and other partners across our great state to identify how we can best help to provide support, education, and advocacy to members of the refugee and new American communities who are impacted by mental illness and suicide. So I do want to thank everyone who helped make today possible. It was a lot of time and effort went into it. I want to definitely thank the teams at SAMHSA, the New England Mental Health Technology Transfer Center, our partners at Nami Connecticut, and our staff here at Nami New Hampshire, as well as our partners here in New Hampshire and Connecticut. Thank you for helping make today's event possible. There is no question that we are without a doubt better together. So thank you.
Thank you. Hi again. Hello. So thank you, Taylor, Liz, and Susan, for giving us a great start of the event. Thank you for the information and programs that you share with us this morning. Hi, everyone. My name is Perry Chen. I'm with SAMHSA Office of Behavioral Health Equity. For those of you who have attended DIPS before, welcome back. If you are new, welcome to DIPS. So as you heard from Taylor, lifting up CBOs and highlighting the great work that from the community is a priority of SAMHSA. So I'm just going to run through a few quick resources that we have some effort in SAMHSA aligning with DIPS. So in August, there will be 2 events. On August 24th, there will be a NET virtual roundtable focusing on exploring innovative strategy for sustainability and retention of workforce. And then earlier of the month in August 10th, we are going to conduct a data workshop. We have heard from many of your peers, that data is something that they wanted to learn more. So there will be a workshop focusing on community needs assessment, where you'll be able to generate data to demonstrate your case. So without further ado, we are going to have 4 CBO speakers, both from New Hampshire and Connecticut, showcasing their work. And then we have 2 important partners to tell us about their organization as well. So without further ado, I'm going to turn it over to our first speaker from New Hampshire, Mr. Clement Kikuku, with the Executive Director of Overcomers Refugee Services. Clement, I'll turn it over to you.
Hi, everybody. Thank you so much for giving me this opportunity. I'm very honored and pleased to be a speaker today. My name is Clement Kikuku. I am founder and executive director of Overcomers Refugee Services. Overcomers Refugee Services is 501c3 nonprofit organization. We have office here in Concord, where we serve all the states, especially Concord, Manchester, and Nashua. We serve all refugees from around the world. We start as, helping only African, and after we extended it to every refugee who come to our door to look for service. So Overcomers Refugee Services is a refugee organization that founded by a refugee, also helping other refugees. As myself, I came as a refugee and I started this organization. So Overcomers has multilingual team of professional and case manager and trained volunteer providing cultural sensitive services that support the refugee as they transition into new American services. So as all the refugee have experience and trauma from violence, civil war, and waiting for so long in a refugee camp. Imagine being forced to flee from your home because of war, persecution, leaving everything behind, and you are now a refugee, having nowhere else to go. And you may spend years and years in a refugee camp. So it's very, very challenging. And when you come to US, arriving in US, everything is different from anything you know, and almost no one speaks your language. That's how it became very complicated. Myself, I came from Africa and I have my college degree. And then when I came here, I couldn't speak English. So I start over again from second start. Starting from learning English. It's like going to kindergarten again, starting by verb to be, verb to have was really, really a challenge for me. Having interpreter everywhere I go, having someone to help me filling the form, application, and everything else. So it was really, really a challenge. And then looking for a job, doing the job that you are not really familiar, and you don't have the time to go out and interact with other people because of the language barrier. It's a very, very challenging a moment. So that's how it is very hard for us. So since I started, the new organization, I really focus on different activities, but focusing on helping people, the organization to keep running and providing more resources for the peace and the reconciliation work, and also add programming that bring people together and offer more services. Next slide, please. As you can see, we really want to increase opportunity for connecting between the New Hampshire receiving community and New American in order to, cultivate awareness, trust, and relationship. This program, putting people together, help our people to, manage their trust and trauma they have. We have been experiencing the COVID-19 plus the trauma that we have in refugee camp. So now it is time for people to go out for events so that we can connect together. Like last month, we organized the New American Got Talent, where the kids came out, families and New American receiving community. So we're together to do this kind of activities. Next slide, please. And then we can see we also organize what we call Umuganda, coming together for common purpose. So we planted, the flower together, but the goal was really to bring the community together and doing activities together and interact. So it was really, really helpful for the community in general. And we also did the mural, which was really, really good. So thank you so much again for this opportunity. And if you have a question, feel free to ask either by chat or the time of question. Thank you so much.
Thank you for your presentation. Yes, if you have any question, please feel free to put in the chat. Otherwise, we have some time at the end of the event for some Q&A and chatting time and coffee time that we are going to have fun together. So next, I'm going to invite Rick Minard, Executive Director of Building Community in New Hampshire. Rick, turn it over to you.
Thanks so much. I'm actually standing in for Eric Irakiza. Eric is one of our case managers who was originally invited to be here today, and I get to take his slot because he was called away for medical reasons. Building Community in New Hampshire, like Overcomers Refugee Services, is an organization by and for refugees. We were founded in 2009 by a group of Bhutanese refugees, and we were the group that Susan referred to. The Bhutanese did have a very high suicide rate, and that got us involved in mental health work. We established a working relationship with and we have continued that to this day. It was a contract with the Mental Health Center of Greater Manchester that allowed us to hire Eric. And he works there about 10 hours a week now. And what we have learned is that most of the new Americans that we work with don't have a concept of mental health and are unfamiliar with the concept of therapy. And they may suffer. As Clement said, many have suffered great trauma. And when they get here, they may feel isolated. So it's not that they don't need help, but they don't know how to ask for it necessarily, or they don't ask for it in ways that native-born Americans might. And so we have to really be thoughtful about how we interact with our clients. To do that, we have tried to make sure that our case managers are all well trained. Currently, we have four case managers, two originally from Congo one from Afghanistan, one from Bhutan, all who came here as refugees. And so they have the language, they have the cultural sensitivity, and we've trained them in community health work. We train them in trauma-informed case management. There are a lot of resources out there now, some offered by the U.S. Office of Refugee Resettlement, and we try to make sure that our team is as sensitive as possible. And we know there's still a long way to go. The challenges faced by the community are often met indirectly. We've been working closely with Laura McGlashan, who's the state refugee health coordinator, to bring groups together in different ways. For example, we've had a photo documentary project going with 3 separate refugee groups, and we're helping to make that happen. Along the way, we've helped bring a curriculum to other refugee groups called Pathways to Wellness. We don't sell it to them, present it to them as a mental health program, but it helps get them started. So there's a lot happening. There's a lot more work to do. SAMHSA has been very helpful in its funding. Thank you.
Thank you, Rick. I really appreciate your presentation, and thank you for your service to our community. Next, we are going to go into a pause for a partner speaker section. I'm going to invite Coach Tony with Brian Cody Brothers and Sisters Foundation. Coach Tony, please.
Hello, good morning. Can everyone hear me okay?
Yes.
Thank you so much for having me. Again, my name is Coach Tony. I am the founder and president of Brian Cody's Brothers and Sisters Foundation. This is my beautiful wife, Tracy. And we are here today to tell you a little bit about our journey, our story, and ultimately we're here honoring loved ones with the hopes of investing in recovery. So we've put a couple of slides together, if we can go to the next one, which provides a little bit of context. It's a little bit of word salad going on there, but since losing our beloved son, Brian Cody, 1,083 days ago, my family and I have learned that everyone knows someone struggling with substance use disorder. Some of us know way too many, actually. So we've committed to improving our community's investment in recovery, and we've done this in a lot of different ways, working with legislators in Hartford, working with town councils in our local municipalities, et cetera. We founded Brian Cody's Brothers and Sisters Foundation, a 501c3 charitable organization, in 2019, and we're here today representing a network of thousands and thousands of good families that have been impacted in the worst possible way by the opioid epidemic. Our foundation's mission is to eliminate any impediment that blocks those seeking assistance with their recovery journey, to create and support outreach programs that improve the well-being of those in our community, to host events that will help end the stigma, and to celebrate that recovery is indeed possible if we invest in it. So in the next slide, what we're doing is we're kind of highlighting just a couple of the areas that our foundation gives back to the community. And we do awareness events. In fact, at the end of August, right before International Overdose Awareness Day on the 31st, we host an annual recovery festival, which is filled with just a lot of beautiful love. Magic shows and carnival games and face painting for the kids, all for free. We have a 5K awareness walk and run that's part of it, that kicks off the day's events. We have live music. We have a recovering artist art exhibit. We have crafters and food trucks and all kinds of stuff. And that's sort of the Super Bowl event for our foundation. That is just a wonderful time. And our primary goal is to make that event free, so that those families and those who are struggling with addiction can come, connect, and build and find resources to help them in their journey. that they're on. In addition, we also are known to just pop up in front of town halls and have sort of impromptu rallies where we kind of bring awareness and talk to communities about resources that we did not know about when our son Brian Cody was struggling. I'm proud to say that we've connected with Demas, and over the last 6 months alone, we have handed out well over 250 Narcan kits. We believe that is saving lives in and of itself. Moreover, we have recovery assistance. We actually connect directly with people who are struggling and their families. We provide coaching, mentoring, and referrals. We provide housing vouchers for those who are in emergency situations. And likewise, we also provide vouchers to folks who are getting done with their inpatient treatment, but need to go to a sober home, a sort of a safe environment to continue their recovery journey. We do transportation assistance, really anything that we can do for anyone that has come to us for help. We do everything possible that we can, to include, pet foster care, transportation assistance, paying for IDs so they can get themselves their job back and things like that. Other areas that we help with in giving back to the community is I don't think everybody understands or hasn't yet made this connection. But when we talk about 100,000 overdose deaths in the last 12 months, what is being unsaid is that there's an entire generation of children, like my granddaughters, my son's children, who are going to have to navigate life without their parent. And so we have created a program called the Youth Hero Scholarship Program, which we're extremely proud of. And every year in June, we hand out scholarships to children across the state of Connecticut, and really anywhere where they can understand that there is a bunch of people they've never met that are behind them, and we help them with scholarships for whatever endeavors are coming next. We have partnered with our dear friend CCAR, which is such an amazing group, in sponsoring recovery coaching scholarships for the people that have gone through this journey and now deep in recovery and understand the power of peer coaching and peer-to-peer relationships. We do food and clothing donations to sober homes across the state of Connecticut. We collaborate heavily with sober homes because we believe that the solution is direct connections from one person to another, utilizing the resources that are found right here in each one of our communities. So we try to shore up the sober homes, which often struggle, trying to pay the bill at the end of the month while they're doing God's work. So in the next slide, what I've done is I've just shared. We could have 50 slides like this, but just some of this the activity in picture. Bottom right hand corner is where you see we have donated food and clothing. On the far left, you see about our festival. The one that is most near and dear to my heart is the one that you see in the top right side of the screen, where someone is telling us that they're now on a recovery journey thanks to the connections that we have provided. My goal here, in summary, is just to let you know that there's organizations like mine that are really struggling to fund these programs that are making real differences in our communities. So any consideration for my organization or ones like ours, we would be deeply grateful. And thank you so much for the work you're doing. In our foundation, we have a name for people that are on the call today, and we call you Hope Dealers. And we are so grateful and thankful for the work you're doing. Let's please keep going. Thank you very much.
Thank you.
Thank you, Coach Tony and Tracy, for being on the screen today and sharing what the foundation is helping our community and families. This foundation is certainly one of the important partners that we need to have in the behavioral health system. And I wanted to thank our CBO partners from New Hampshire for sharing your great work. I know we don't have enough time. 5 minutes is not enough to tell us, but I want to encourage all the participants to reach out to this organization, click on their website, send them an email. Partnership is the key. Partnership is part of the hope. So without further ado, I wanted to invite our next partner, Favor, Carolyn and Maguna from Connecticut to share with us the work that they do.
Hi, good afternoon. This is Karen Westerholm. I'm the director of the Family Peer Support Program at Favor. Next slide, please. That's not ours. Next slide.
I'm sorry, we don't I don't have an additional slide in the deck.
Well, if you'd like to share slides, we don't have others in the deck for you beyond the header slide.
Okay, that's fine. So just a little history about Favor. We were established in 2001 and became fully incorporated in 2002 as a nonprofit statewide multicultural family organization. We serve families, children, and youth dealing with a broad spectrum of behaviors and mental health needs by providing family peer support and policy initiatives. The programs under Favor are the Family Peer Support Program, the Family System Manager Program. We have the medical, Connecticut Medical Initiative, and we have the Learning and Leadership Academy. Now, all of our peer support specialists have a lived experience by having a child or a family member with some type of behavioral mental health challenge. We are direct service to families. We help them navigate the special education and the mental health services that we have all faced as peers in our personal lives. We engage with families immediately as we share that we do also have a child with some sort of mental behavioral health challenge as well. We encourage and empower families and let them know that they are in the driver's seat because they know their child best. We meet with families, we listen to their story, we gain an understanding of their perspective. We are here, their story, we are identifying needs, their struggles, their strengths, and building a team for them so that they can continue without us. This helps to build a team. We spend endless hours endless amount of time teaching families their rights, to empower them and to encourage them that they can do this as well on their own. We support our families at every meeting needed, and we help build agendas, but ensure that when they're at the table, their voice is heard and they're included at every decision-making process for Favor. I'm going to turn this over to Magina.
Hello, good afternoon, everyone. My name is Magina Delan. I'm positioned as the Director of Family Engagement with Favor. The program that I am charged to guide and direct is the Family Systems Managers. They work in collaboration to support the development of an integrated, family-driven, and youth-guided system. Specifically, the Family Systems Managers Coalition Build. This work requires connecting multiple sectors of the community to collaborate and develop plans, policies, and implement strategies to support prevention efforts. And they do this by supporting the identification, recruitment, and participation of families in the behavioral health system, analysis, planning, and service provision. As well, working in partnership with the Department of Children and Families, hub service agencies, and other system leaders and stakeholders to advance the health and well-being of children and families. Favor's Family Engagement Technical Assistance component offers education, technical assistance, and mentoring to assist in the development of a family-driven and youth-guided practice in systems advocacy. Again, you could see a lot of this great work on www.planforchildren, and this information will deliver a potent position on the local and regional work of the family systems managers in partnership with families, schools, and community partners across the state, supporting the alumnus work to improve and integrate children's behavioral health service systems and supports into a network of care. And just before I leave you, I just want to give you this. Here is what a coalition can do when children and families are involved. When children and families are involved, they provide talent, skills, and resources that can be shared to achieve program goals. It ensures that community mental, behavioral health, and wellness and prevention approaches and materials are culturally sensitive for targeted audiences. Because everyone in this coalition, the members themselves, represent the community. As well, provide a forum for open discussion, mutual support of a common goal with a ripple effect for organizations that the coalition members represent. And this broadens the base for support and trust. And as well, reduce the chance of duplicating efforts, eliminating competition for resources, and improve communication within the community. So thank you, and I will be sure to get the slide with contact numbers for the family system managers across the state of Connecticut. There are 6 for the 6 regions, as well as the directors of each program of favor. Thank you again for allowing us to be a part of this opportunity.
Thank you, Favor. Thank you so much for your great work and allowing family and participants to be on the table to make their voice heard. I really appreciate it. Next, I'm going to invite Reverend Barger with Black Ministers Alliance. Reverend Barger, please.
I want to say good afternoon to everybody. Giving honor to God and who is at the head of my life, I just want to say thank you to DIPS for having me here this afternoon. So many great organizations that we're hearing from today. And the Black Ministerial Alliance is a group of African-American ministers of color who are trying to advocate for people of color in the city of New Britain. And we're inviting anyone and everyone to come alongside us and assist us in all of those things. We have several programs that are taking place simultaneously. The biggest ones right now are this community cookout that we're having this Saturday. And this community cookout happened as a result of us over the last couple of years of providing food for those who are unhoused and for those who are less fortunate. And after doing that for a couple of years, at the end of last year, the question came up on our, at one of our monthly meetings. What are we really doing? Are we really helping people? Because, if you continue to give a person a fish, you enable your organization to do that continually. And we wanted to be more than just somebody who provided a fish. So the idea of mental health came up. And we said, well, this year when we have these events where we monthly try to, feed the community, feed the unhoused, we're going to add to that all these different organizations in the city of New Britain that can help out and advocate in bringing people to the next level in their health. And mental health is so huge, and especially in our children. Behavioral health. So what we did, we contacted a number of social agencies, CHMA, the Public Health Department that does vaccines, Griffin Health, HRA, Wheeler Clinic, and I'm also on the board of directors for the Friendship Center. We connected with all these different agencies. And last month, we had them come out, we did a community cookout in July. We had the police department there. We had EMS services there. And, some of that is seen in some of these pictures here. We also had Peace Missionary Ministries there, which is the church that I pastor. And what we're trying to do is not just feed the community now, but also help them to be aware of some of the services that they have access to. And because our community is so diverse, Asian, African-American, Muslim, Jewish, Polish, there's so many. And what happens is, and Hispanic, and a lot of times these communities, people are fearful, especially when they just get here and they're afraid of being deported and they don't want to show their faces downtown. So what we're doing in terms of bringing all these health organizations to the cookout is we make that a less severe situation where people do not feel threatened and they're able to connect with these different organizations. And now, they have access to these different health organizations. And this Saturday at 180 North Street in New Britain, we're having another community cookout. And it's going to go from 12 to 2. And we're just over the moon about the opportunity that we have to help people know that they can receive some help. And helping the community grow in this manner, it's more than about just religion. It's more than just about, one singular aspect of their lives. And by doing this, we're helping people to have a healthier community. There are several other programs that we are doing simultaneously that I don't have time to talk about. But if anybody wants to know more, we have the Martin Luther King Corridors Initiative. We have these prayer walks that we're getting ready to jump off with. And we're just doing some great things in the city of New Britain. And just want to say thank you to DIPS again for having us this afternoon. And you guys just continue to do all that you're doing and don't get weary in well-doing. God bless you and have a great day.
Thank you, Reverend Berger. And I really appreciate the community service that you bring to all of us. And thank you for empowering all of us as a leader to reach out to all the partners that shows on the pictures of your slide. So that is great. Next, I wanted to invite Ingrid from New England Mental Health Technology Transfer Center. She's our communication and program specialist, and she is the one working very hard to put today's event together. We have run off show, our script, make sure that we are on track. Ingrid, pass it to you.
Oh, thank you so much, Perry. It's my pleasure to share more with everyone about the New England MHTTC and our training, technical assistance, and tool and resource development work. Our core area of support is recovery-oriented care and recovery supports. Our mission is to use evidence-based means to disseminate evidence-based practices in mental health across Region 1. Our team consists of faculty and staff from Yale University Program for Recovery and Community Health, the Harvard University Department of Psychiatry, C4 Innovations, and the Center for Educational Improvement. And we think this gives us a unique lens to address mental health priorities across the lifespan. The New England MHTTC is a culturally responsive organization, and through programs like our Indigenous Behavioral Health Initiative, Marginalized Youth and Collegiate Mental Health Supports, Early Psychosis Learning Collaborative, and public awareness campaigns highlighting mental health and recovery and support for Latinx communities. We promote racial equity and culturally humble practices in behavioral health. In 2020, amid ongoing racial injustice and great civil and political unrest, we launched a strategic process called Better Together to guide our intentional efforts to expand the organization's racial equity lens in terms of policies, structure, activities, and engagements with diverse audiences. Through this effort, tell you a little bit more about what we prioritize on the next slide. We really wanted, with the support of staff and stakeholders, to prioritize outreach and engagement, particularly to racially and ethnically diverse audiences. And when we amplified the voices and perspectives of people with lived experience, we learned that there was really a need for safe spaces and gathering places where teams from agencies and organizations could hear from experts in the field of diversity and inclusion, share evidence-based materials, and really help people learn how to develop and put into place policies and practices that ensure cultural responsiveness, as well as workplace equity. And so on our next slide, that's just what we did. We created a training table. Our racial equity and advancing cultural humility reach for organizational change activities are really about helping organizations to truly reach for that change. At our training tables, we provide practical ways to address racial equity and to consider the multiple levels of cultural responsiveness needed for optimal behavioral health treatment, recovery, and care. And our REACH initiative dovetails so nicely with the DIPS model and the goal of connecting smaller, less visible CBOs and local nonprofits who are doing great work in their communities to more grant funding and opportunities to enhance their visibility and viability. And so I'd like to leave you kind of with the words from our co-director, Maria Restrepo-Toro. On the next slide, she typically always says this in our meetings. So real change happens when we share our lived experience and take actions that support inclusion. At the end of the day, we really want the same things, right? Respect, meaning, purpose, and opportunity. So thanks for pausing for a partner and learning more about the New England MHTTC. On our next slide, you can visit our website and access more information on our programs and services. And please feel free to reach out to me for information on how you can join our training table and access our resources. Thank you.
Thank you so much. Unfortunately, we are running out of time for Q&A, but I wanted to point out that today's DIPS event doesn't end here. We are going to continue this momentum and connect with each other. As Taylor mentioned earlier of the event, today's slide and recording will be posted on SAMHSA website, and I hope that we will continue this partnership. With this, I would like to turn it over to Taylor Brian Turner, who's our Region 1 Assistant Administrator. So Taylor, turn it to you.
Perry, you have been so incredible to us today. Thank you so much for sharing your time and your passion and bringing that central attention to our regional offices. As you can see, we have so much to offer here in the region, and we didn't see any questions in the Q&A, and that's okay. If you want to share your contact information, your websites, please do that now. Make sure that we have everything that we need to post on the websites to elevate you, highlight the work that you're doing. Make sure that we have your contact information. Pastor, we're going to need those dates, locations. We want to know what's on the menu. We want to be able to come to Connecticut and support you in those efforts for what you're doing in prevention, treatment, and recovery spaces. As mentioned, we've been dubbed hope dealers today, and we thank you for that sentiment, Coach Tony and Tracy, for sharing your lived experience with us. I feel inspired and encouraged in our work in prevention, treatment, and recovery, and mental health, and I hope you do too. We are honored that Nami reached out to us to say, we want to improve our work in this area. Can you help us do it? And DIPS is one of the many ways that we hope to elevate our BIPOC community efforts. And we hope that we've spread some love and some joy to increase partnerships today. Today's event would not be possible without this collaborative effort with Nami Connecticut, Nami New Hampshire, the New England Technology Transfer Center for Mental Health, OB's Perry Chen, who moved mountains to hear from you today. I'm so happy he moved things on his calendar to be with us. And the Addiction Technology Transfer Center, thank you so much for your constant support. I feel grateful for their support in uplifting this DIPS model. And I can't say enough about all of our presenters today. Beautiful work. This is what keeps our virtual boxes lit up with your hope and inspiration. So I encourage you to access the resources and connect with the organizations you heard from today.